This is the injury report presented by NYU Langone Health. Yankee shortstop Anthony Volpe has played through a small tear in his labrum for more than 4 months and got his second cortisone shot last week for pain management. So in today's injury report, we're talking with Dr. Kirk Campbell, who's an orthopedic surgeon at NYU Langone, about if the most recent cortisone shot will be enough to get Volpe through the season and the playoffs, forever long that this Yankees run will go through. Doc, thanks for hopping on with us. I read that you're assistant team physician for the White Sox, so you are the man to talk about this. Can you break down what a partial labrum tear in the shoulder means, specifically for a shortstop who dives, throws across the body, makes all types of athletic movements? Like, what are the limitations for Volpe?
So great question. Thank you so much for having me. So he's a shortstop, as you alluded to, lots of dynamic movements. Right, he's doing a lot of diving. The good news, for him, in terms of playing, it's his non-dominant shoulder. So he's right-handed, and he injured the left shoulder on that play back in May. Let's take a step back. What exactly is the labrum? So the labrum, it's a soft tissue, special type of cartilage in your shoulder that gives the shoulder overall stability, right? So it plays a really critical role in stabilizing the shoulder because the shoulder is made up of two main bones, right? You have your flat glenoid and you have your round humeral head. The flat glenoid has that special bumper or labrum on it. So he has a small tear, of that labrum. Not exactly sure what small tear means because, again, I am not the team physician, so I do not have access to his medical records. But I was able to review the injury, the video from the injury, and, it looks like he may have injured the front part of the labrum. He may have had a slight dislocation or subluxation of the shoulder, injuring the labrum. So in terms of playing shortstop, when he's diving, he's going to be thinking twice about it. He's at risk for further re-injuring it. When he's hitting, that's going to be his lead shoulder, so he's going to follow through, and it's possible that may aggravate the injury as well. And the purpose of the cortisone injection, it does not heal the labrum. That reduces the inflammation, irritation, and pain associated with it, so they could continue to play and rehab.
So when someone feels a pop like he did back in May, then he continues to play, what kind of long-term damage could that do to the shoulder?
No, Another great question. So, in terms of long-term damage, if he continues to have these incidents where he continues feeling, little pops in the shoulder, maybe he swings and follows through and, further damages the labrum, that labrum tear will get bigger and his symptoms may increase, where now he may go on to developing a true instability of the shoulder if it's in fact that, front part of the labrum or the anterior inferior part of the labrum that is torn. So there's certainly some concern for further, progression of the tear into something that may potentially need surgical intervention in the future.
You mentioned the cortisone shot. The Yankees gave him his second cortisone shot of the season last week. Was that mainly for, I guess, the pain management in the short term? And is there a risk that once that shot wears off, the second one, that symptoms can return or even worsen, especially with the overuse, or even, let's say, he dives to make a play?
Yeah, so cortisone injections in general, powerful anti-inflammatory. On average, you get about 3 months of symptomatic relief from a cortisone injection. So, thinking of his timeline, he got, roughly that amount of time from the first one, got a second one, so the goal would be to get him through the postseason. Hopefully, Yankees do end up going very far in the postseason. It's more of a pain management strategy, right? So they could build strength of the surrounding muscles. Is it possible that once it wears off, symptoms may worsen? Yes, that's a possibility, especially if the tear progresses.
So, $1 million question here. If there was a non-pro athlete had a partial labrum tear, how would you suggest that they treat it? Like, would it be different from the Yankees approach with Volpe?
I think they're doing, the medical team, training staff, I think they're doing a fantastic job of managing this really, really difficult injury in a very high level athlete. For the average New Yorker with a shoulder labral tear, small tear, physical therapy, anti-inflammatories, if you're having significant pain and discomfort, then yes, you could consider a cortisone, injection. The other option, there's something called PRP or platelet-rich plasma, which is, one of the orthobiological options that we have, could be another potential treatment option. When those things are not working and it's affecting quality of life, that's when you start thinking about surgical intervention to repair the labral tear because it does not heal by itself.
Well, hopefully there's some Yankees fans that watch this, and maybe they won't send a negative tweet to Volpe now that they know he's been playing with a torn labrum
Yeah,
since May. But
he's a tough guy. He's really put himself at risk for further injury. So definitely they should be thanking him for playing through a really challenging injury. If anything, he should be lauded for what he's been doing with such a difficult injury.
a Yankee fan saying something nice, Doc. I don't know about that one. But thanks for hopping on and clearing up this Volpe injury.
Thank you for having me.